Hello, and thank you for joining us for our analysis and hypothetical action plan for the challenges faced by Dr. Bonnie Henry throughout the COVID-19 pandemic. For the purposes of this presentation, we request you first read Bend It Like Bonnie, Power and Politics During a Pandemic for a more in-depth understanding of Dr. Henry's professional background, which would have honed her leadership skills and increased her credibility with the population.
Dr. Henry's ability to balance authenticity and transparency with empathy and optimism quickly transformed her into the poster child for public health leadership throughout this time of crisis. Her calm and honest delivery of scientific facts and ongoing emphasis on empathy towards others had a significant impact on the adult vaccination rate in BC. While BC's adult vaccination rate landed at a respectable 87% in November of 2021, early trends indicated that the successful adult vaccination campaign was not likely to yield similar results in the pediatric population, with at least 15% of parents declining to vaccinate their children and numerous others on the fence. Hesitancy surrounding pediatric immunization could be attributed to the following: misinformation, which is false and unfounded opinions being paraded as science on various social media platforms; missing information, meaning valid concerns about safety and efficacy of the vaccine; the speed of the vaccine rollout, which in all fairness was quicker than past vaccinations given the urgency of the pandemic; the fact that children, for the most part, suffered less severe symptoms from the virus; and finally, the emotional burden, meaning it's more challenging to decide for a loved one without fully knowing the outcome of the choice. In addition to the obvious province-wide pandemic-related repercussions associated with vaccination rates, Dr. Henry's ability to navigate the pediatric vaccine rollout will place additional scrutiny on herself as a leader. She needed to convince ambivalent parents to vaccinate their children, not only for their own safety, but for the greater good of the public. If her directives were too firm, she would lose the public's favor, thus giving misinformation a stronger foothold in the narrative. But if too loose, the risk for the virus to gain the upper hand in the province was becoming increasingly possible. Not to mention the risks associated for her personal and professional relationships, given the increasingly polarizing discussions surrounding vaccination. So what should Dr. Henry do? How can she balance public relations and public health to retain her credibility and authenticity while optimizing the number of youth vaccinations? The information within this presentation switches to hypothetical at this point for the purposes of the assignment. While ideas are presented as Dr. Henry's opinions or actions, the following action plan was merely devised for the purposes of the assignment. It was quickly decided that misinformation was the main culprit when it came to vaccine hesitancy, and any vaccination plan would require direct, open, and honest communication supported by credible sources. Helpful tips and tricks on how to find credible sources and discern less than credible ones will be a must regardless of whether Dr. Henry chooses to mandate vaccination. This allows parents to feel that they have all the facts prior to making a decision affecting their child, and offers them more reassurance when making that choice. It was also decided that mandatory vaccination for extracurriculars and school would only serve to isolate children who had already suffered from social isolation policies in the early days of the pandemic, while also further polarizing and politicizing the cause. As such, voluntary immunization would have to be maximized. To merge the two themes, a plan to create a more open and interactive vaccination clinic with several stations dedicated to children and parents specifically was created. An array of fun activities will be present for the kids, as well as age-appropriate resources and activities on the importance of vaccination, misinformation, social distancing, hand-washing, and more. For the parents, there will be information on how to spot misinformation and how to find reliable sources, as well as credible research geared towards the benefits of vaccination. The clinics will need to be run on a sign-up basis to adhere to social gathering restrictions, but the numbers can be altered based on COVID-19 rates within the areas. At the end of the forums, parents will not be forced to vaccinate their children. Instead, they will be encouraged to consider the information they have learned and to seek out additional information through reliable sources to ensure that they are, in fact, making a decision that they can be comfortable and confident in. If a parent is hesitant, staff will not pressure them. If parents choose to leave without vaccinating, the message will remain clear. We are here when you are ready.
Increasing COVID vaccination rates among children requires a collaborative effort from key stakeholders. Despite children being the target demographic for this phase of the immunization plan, their inability to provide sole consent means Dr. Henry must adapt her strategy to influence the parents and guardians who will ultimately have the final say. The implications of low child vaccination rates have a wide-scale impact on the population. As such, stakeholders must include leaders in government, healthcare, and communities who can deliver consistent messaging, instill trust in parents, and make vaccination accessible to all children. Federal and provincial levels of government play a crucial role in setting vaccination guidelines, procuring vaccinations, and distributing them across the country. They also provide funding and support for vaccination programs. To effectively boost vaccination rates among children, Dr. Henry must garner support from government agencies to ensure her initiatives align with public policy and can be achieved using the funding provided. Collaboration with international organizations such as the World Health Organization and the Centers for Disease Control and Prevention allows for the exchange of best practices and resources to support vaccination efforts on a global scale and helps maintain consistent messaging for parents who may be influenced by the general consensus. Dr. Henry must also establish relationships with research institutions, experts, and pharmaceutical companies that are directly involved in manufacturing, testing, and evaluating the efficacy of the vaccines. These partners must be transparent and accurate when providing data on vaccine safety, as this information serves as the basis for the campaign to dispel misinformation. Once the campaign is underway, vaccines must be readily available for willing consumers. As multiple pharmaceutical companies hold stake in supplying vaccines, Dr. Henry and experts will rely heavily on research findings and expert opinions when endorsing a supplier. It is imperative that these stakeholders demonstrate ethical and altruistic motives to reaffirm the values of the initiative. Stakeholders at the community level include public health authorities, frontline healthcare providers, educational institutions, and faith-based organizations. Local level stakeholders have a vested interest in the outcome of vaccination rates and slowing the progression of the pandemic, as many are parents, business owners, and members of the community who may be negatively affected by COVID-19 infection. These stakeholders have the advantage of being able to engage with parents frequently and directly. A study by Segal et al. Indicates many parents report vaccination hesitancy due to mistrust of government and lack of knowledge about vaccine safety. Nurses, doctors, educators, and religious leaders serve as trusted and familiar sources of information. In addition, schools, health units, and primary care offices are great locations to disseminate information and vaccines to parents and children. Data reporting by these institutions is also beneficial for Dr. Henry to receive accurate statistical information on vaccination rates as the immunization plan moves forward. Finally, parents and guardians are key decision makers when it comes to vaccinating their children. It's essential to approach them as partners, listen to their concerns, and provide them with accurate information about the benefits of vaccination. Social media and news outlets have a great power in shaping public opinion and perceptions about vaccinations. As part of the immunization plan, Dr. Henry should consider the media to be a key stakeholder and develop a partnership with popular channels to provide awareness and fact-based information for the parents and population at large.
The basis of power model, originally conceptualized by French and Raven in 1959, outlines the following 6 forms of leadership power and the potential effects of those influences. Dr. Henry demonstrates a diverse power base in her position as Provincial Health Officer. Her extensive knowledge and expertise in the field of epidemiology, previous experience as Medical Health Officer in Toronto during the SARS pandemic, and her public commitment to maintaining trust, integrity, and honesty during the COVID-19 pandemic exemplify legitimate, expert, and referent power. Through continued competence and transparency in her position, Dr. Henry is likely to yield high levels of compliance with partnering agencies and organizations who share similar goals and values. Dr. Henry's authority enhances the persuasive nature of her arguments and supports the legitimacy of her requests and recommendations. An element of reward power comes into play, as Dr. Henry is a prominent figure with a large platform upon which she can speak favorably about key contributors. Praise and acknowledgement are motivational strategies that reinforce collaborative efforts. Unfortunately, Dr. Henry's expert and legitimate power may not have the same effect on parents and guardians who are not formally partnered with health authorities. As a result, Dr. Henry can use her referent influence to build trust with the public and reinforce altruism as the reward of wide-scale vaccination. To gain trust, Dr. Henry should continue to be visible, empathetic, and honest, using the power of information as it becomes available to ensure community members are aware of emerging research, vaccination clinics, public health statistics, and the impact of the immunization plan. It is important to note that frequent updates may have both positive and negative effects on compliance, as public members are free to interpret data as they wish. For example, a surge in COVID-19 rates may be interpreted by some as proof that the vaccination is ineffective. Dr. Henry's ability to convey the data in a way that meets the literacy levels of various groups will be instrumental in achieving buy-in from the public. As a leader who has founded her campaign on promoting health, safety, and working towards a common good, Dr. Henry should avoid coercive power influences that may be seen as manipulative or punitive. Restricting freedoms of speech, for example, may be an effective means of stifling the spread of misinformation, but it undermines the trusting relationship between health authorities and the public. It's important that Dr. Henry reinforces the parents' right to choose to vaccinate. Leaders who demonstrate wholehearted faith in the evidence and tactics of their coalition should not have to manipulate others into compliance. Instead, Dr. Henry can speak on behalf of the experts and leaders to refute misconceptions and provide community leaders with the resources to engage in evidence-based discourse.
Obtaining herd immunity in the province is the best chance to protect the most citizens, especially the vulnerable people who cannot safely receive the vaccine. That means immunization rates need to land somewhere between 70 and 90%, ideally closer to 90%. Making vaccination mandatory might seem like the logical answer, but would that work? The short answer is no. Forcing people to be vaccinated has been debated as violating the Canadian Charter of Rights and Freedoms. So, what is the alternative? The vaccine passport? We give people the choice, but severely restrict access to non-essential services, extracurricular activities, venues, gatherings, etc., if they cannot provide proof of vaccination. For many, that can be seen as coercion, and for those who cannot receive the vaccine for health or religious reasons, for example, the word discrimination comes to mind. Cherrier and Associates evaluated the success of mandatory versus voluntary immunization policies in several well-developed European and North American countries. Those who mandated COVID-19 vaccines did not have the success they hoped for, but in countries where immunization was voluntary, rates as high as 95% were achieved. Providing consistent, fact-based messaging across various media platforms serves as a powerful antidote against the spread of anti-vax propaganda. By providing accurate information about vaccines, their efficacy, and safety through transparent channels, we empower our citizens to make informed decisions based on scientific evidence rather than misinformation. When the public has access to truthful, transparent data from reputable sources, it becomes more challenging for anti-vax narratives to gain traction. Moreover, this method fosters trust in public health institutions and professionals, reinforcing the importance of vaccination in preventing the spread of COVID-19 and protecting community health. Addressing the 3 C's of vaccine hesitancy, convenience, complacency, and confidence, requires a multifaceted approach. First, convenience can be enhanced by improving access to vaccination services through initiatives like mobile clinics, extended hours at vaccination sites, and offering vaccines at locations where people regularly visit, such as workplaces and schools. In our action plan, we have set up fun, interactive, and educational events that engage not only parents but also their children, inspiring them to ask more questions, share information with their peers, and advocate for themselves. Establishing this healthy stance on immunization early in life can help protect the public well into the future, beyond the COVID-19 pandemic. Secondly, addressing complacency involves raising awareness about the ongoing importance of vaccination, even when the danger may seem less prevalent due to falling number of cases. This can be achieved through continuously updating our educational campaigns as new data and research comes to light, as well as emphasizing the potential consequences of not vaccinating and highlighting the benefits of vaccination for both individuals and communities. Finally, Building confidence in vaccines requires transparent communication about their safety, efficacy, and the rigorous processes involved in their development and approval. Engaging with communities, addressing concerns respectfully, and providing reliable information from trusted sources are essential steps in fostering confidence in vaccination. By addressing these 3 C's effectively, we can overcome vaccine hesitancy and work towards achieving widespread vaccination coverage.
In early days of the pandemic, Dr. Henry was hailed as a beacon of honesty and hope. The public trusted her and listened to her guidance. People were staying home, only necessary travel was taking place, and we thought we had a handle on it. As time wore on, so did people's patience. A COVID-fatigued population began tiring of Dr. Henry's messaging. The situation even escalated to receiving death threats. The need to keep the province's trust and faith was evident, or everything she had worked for would fall apart. Dr. Henry was relatable and intelligent. Despite having everyone's best interest in mind, she knew that she couldn't please everyone, which most of her constituents also understood. Regardless, as time went on, she saw her population losing interest, losing compassion, and losing hope. People were on the verge of revolting should another lockdown be put in place. Dr. Henry needed to find a way to save the province and save face. She knew that pediatric vaccination was imperative to both. With the pediatric rollout, Dr. Henry needed to become the leader she was pre-pandemic fatigue. A leader you would trust with your health. One that would make you feel comfortable getting your child vaccinated because you know that she would do the same for her kids. She needed to let the public in, educate them, and let them know that this is for the greater good, not to line a pocketbook. We're protecting our grandparents, our immunocompromised, and our most vulnerable. The province needs to know what they're fighting for through facts. Dr. Henry couldn't let misinformation skew what she fought so hard to obtain in 2020.
While one of these leadership styles alone would not be helpful in the middle of the COVID-19 pandemic, some characteristics of each, blended, might make the perfect leadership style. Autocratic would never work. People don't like being ordered what to do based on one person's opinion, especially when everyone is stressed and afraid. Demanding kids get vaccinated is not the solution either. Parents need to know the facts, and if they are hesitant with their own vaccinations, of course they will be reluctant with their children. Democratic, participative, letting people be part of the decision-making process can be a little too flexible in this situation. They would basically be saying, here's the vaccine. If you want it, great. If not, oh well. There is no sense of urgency or intent. There has to be a happy medium in between fear-mongering and apathy. Laissez-faire is an anti-vaxxer's dream. This hands-off approach holds no accountability to the public. It's basically just going through the motions in hope that the public will follow. But this type of leader is just fading into the background when you need someone to stand out. Smithson speaks to the requirement of a leader to be both disciplined and agile. A one-track leadership style will never work, especially in the face of a pandemic. This may be uncomfortable for some leaders as they are usually set in their ways when it comes to managing their staff. But when leading a province, that should all be put on the back burner and the focus be placed on leading. Dr. Henry was able to do this by being both fact-sharing and empathetic. Dr. Henry needs to be as she was with the adult vaccine rollout, with the same transparency, research-based facts, and accountability, with a little bit more relatability. While she has been quite open and personable throughout the entire ordeal, we need to see how she would handle this situation if it was her. Does she have small kids? Nieces? Nephews? Would she be standing in line with them? If parents hear that their child is unlikely to get sick, they may not think the vaccine is necessary. But if they know their child could carry the virus and have a detrimental effect on their grandparents without knowing, parents need to hear that. The children may be friends with a vulnerable child who they could make very sick. They need to know that. If parents are given the facts with realistic consequences and a fact-based approach on how getting their children vaccinated is for the greater good, they would be more likely to comply.
Dr. Henry and her colleagues have poured everything they've got into ensuring that the public has both the tools and the access needed to ensure as many as possible make it to the other side of this horrible pandemic. Evaluating specific metrics continuously throughout the process will ensure that modifications can be made as necessary to achieve greater success. The most straightforward metric to evaluate is immunization rate. Immunizations within the province are all tracked through health cards, so the data is easily accessed and processed. Data can be organized into a number of categories, but given the purposes of our action plan to target the pediatric population, rates can be examined for children under 18 years old initially, and further subdivided if a pattern appears, such as lower rates for children below the age of 5, for example. Comparing rates from the initial vaccine launch and every month after initiation of our targeted campaign can help identify gaps in the knowledge and data being shared with parents and caregivers. Disease incidence is also an important indicator to the public that the vaccines work. Tracking pediatric cases of COVID-19 is difficult because cases can often go undetected related to the mild or often asymptomatic forms of the disease that children experience. However, data surrounding hospitalizations and deaths is easier to obtain. Increasing immunization rates directly correlating to decreasing numbers of hospitalizations and deaths is a clear-cut fact that is pretty hard to ignore. The most important way of figuring out why or how something is working or not is to ask. KAP surveys measure changes in knowledge, attitudes, and behaviors related to vaccination among the target population, providing insights into the campaign's impact on vaccine acceptance and uptake. Conducting the surveys before, during, and after the campaign launch can help identify important topics that need to be addressed to decrease hesitancy. Hopefully, a substantial shift in knowledge, attitude, and behavior towards parents choosing immunization for their children will be apparent when evaluating the surveys. And lastly, cost effectiveness. Comparing the cost of delivering our campaign versus the estimated savings to the healthcare system with decreased incidence of severe illness and hospitalizations. Although this is not often seen as a metric that would sway public perception, it can certainly garner more political and stakeholder support for Dr. Henry, ensuring continued investment in the campaign, thus ensuring sustainability.
Dr. Henry is already known as a trusted public figure. While she isn't loved by all, the province does still look to her as a leader in their time of need. To maintain this role and ensure the safety of her province, Dr. Henry's handling of the pediatric vaccine rollout must be meticulously well thought out and presented in a transparent light. Avoidance of mandates and coercion are key to ensuring herd immunity can be met. Dr. Henry must instead focus on educating and advising the public. As discussed previously, mandated vaccination serves only to create mistrust without resulting in higher immunization rates. By emphasizing the voluntary nature of pediatric immunization and publicizing the fact that the BC health authorities feel that it is not only important to vaccinate your children, but to feel confident and reassured in making this decision, Dr. Henry is retaining her relatable, trustworthy, transparent, and authentic role as leader. A campaign that focuses on educating both parents and children, not only on the importance of vaccination, but more importantly, on how to spot misinformation and find credible sources to help boost confidence in any healthcare choice they are required to make, is an effective way of empowering the population to question what is shared on social media and ensure that no parent is feeling coerced or manipulated into vaccinating their child. Achieving herd immunity among children in BC is a milestone, and with only 15% of parents declining to immunize their children, it is a very realistic goal. Steadfast anti-vaxxers are unlikely to change their minds, but with the correct education and access to resources, ambivalent parents will be longing to seek out information and do right by their child. Vaccination clinics will need to be organized to ensure everyone can be immunized, regardless of their format, and the research to support vaccination is being performed regardless of the platforms through which it needs to be shared. By providing education and peer-reviewed information at the point of vaccination and intertwining some fun activities, this clinic should serve to boost confidence in vaccination as well as the government, and lead parents and children to improve upon their health literacy and critical thinking skills. As parents ourselves, we understand the drive to do what is right for our children. We want BC to not only feel that they are making the right decision in vaccinating, but to know that they are.